everybody, to another episode of Security Confidential. Today, we are honored to have Nicholas Potts join us. Nicholas is an extremely successful entrepreneur who started his journey, you won't believe it, at Enterprise Rent-A-Car, and then from there ended up in Fortune magazine as the CEO of ScriptDrop, a highly successful pharmaceutical delivery service. And now he has a new project in giftHealth. So, Nick, thank you for joining us. It's a pleasure to have you on the program today.
Yes, thanks for having me. I really appreciate the time and look forward to the conversation.
By the way, did I miss anything there? I mean, you're a very successful person. I want to give you all due credit here. So, is there any part of your bio that I skipped over by chance?
No, definitely had a great experience working at Enterprise Rent-A-Car directly out of college. And then I joined Cover My Meds for a number of years and got to help grow that software company, which they eventually were acquired by McKesson for a little over $1 billion. And then I left from Cover My Meds to start ScriptDrop about 4.5 or 5 years ago. And over the time that I was the CEO of ScriptDrop, we got up to about 150 full-time team members, and the solution is used by thousands of pharmacies across the country, and has helped, I believe, up to 3 million or 4 million patients at this point, which of course is what we're in healthcare for, is to help those patients. So that's always really exciting.
That's incredible. What a great story. And, we've had on Security Confidential, we've had so many CEOs and entrepreneurs on in past episodes, and all of their journeys were very, very unique. And part of our mission here is, of course, talk about cybersecurity, but also to broaden people's horizons a little bit. And that's why those journeys become so relevant in case there's someone else that's listening that wants to consider pursuing their own dreams. And
Yeah.
from enterprise to giftHealth to ScriptDrop, how do you make that transition?
That if you've never done something, that does not mean you can't do it or you can't learn to do that. And just having that confidence in, hey, I can figure this out. I have the ability to if I work hard enough, and I can find success in that. Whereas a lot of folks, they end up not becoming an entrepreneur, launching a company, and it's often due to fear. And once you can get past that, you can really see what type of ceiling you have, and it's incredibly exciting to do so.
We on a past episode we talked about one of the pieces of advice was never make decisions out of fear. You have to do something. If you're going to do it with self-confidence and do it with a degree of commitment. I think that's so easy to say, but I can tell you in my own instance, it's a very difficult thing to get over. It's not
Yeah.
a trivial bump.
Yeah, well, humans were social creatures. So even if you say that, your neighbors or friends and you say their opinions don't matter, they do. And that is oftentimes what leads to that fear is, hey, I could start this company, but I look at the stats and it says that 95% of startups fail or 90% of startups fail. So that's a high likelihood that, my friends may make fun of me or my neighbors may laugh at me or whatever. But you don't understand sometimes the flip side of that even if you do fail, in using air quotes when I say fail, you actually succeed in that journey, by launching something, by building a company. And as much as you learn throughout that journey, even if the company, 4 years into it, it ended up not working out, you still are so much stronger because of that journey that you're better prepared for the next thing that happens in your career, whether that's joining another company or starting another startup.
And Nick, let me ask you: did you have a background in pharmaceuticals out of college? Was that what your education was in?
So, yeah, not at all. I grew up in the South, so I grew up in Nashville, Tennessee.
Music
And I
City.
did, yeah, yeah. So grew up in Music City. I can't sing or anything like that. I can't play instruments, so that wasn't bred in me at the city. But growing up, I wasn't really into technology. I don't even think I had a computer at my house until I was in college. But really got into technology once I moved from Nashville to Columbus, and then got into the pharmacy space when I joined Cover My Meds, and was really fortunate to work under some folks that were incredibly experienced, and they kind of expedited my learnings. What may have taken me 10 years to learn, I was able to pack it into a condensed 2.5 or 3 year period at Cover My Meds. And it really set me up to kind of succeed or have a better chance of success along the way with ScriptDrop and now giftHealth.
Was there someone that helped you come up with a big idea for ScriptDrop, or was that your own brainchild? How did that innovation happen?
Yeah, that was my own brainchild. How the innovation happened is I'm really big into data. So I would pull reports and just for fun, which sounds crazy to some people, and I like, looking at the data and just understanding the numbers and conversions and just tracking, patients or users through platforms. It's really interesting to me. So that's how I came up with the idea for ScriptDrop. Is I noticed that patients across the country, if they were asked to come back to the pharmacy, so let's use the example, if I dropped off my prescription today and they do not have it ready immediately and they say, Nick, can you come back tomorrow or come back in 5 hours to pick this up? About 15 to 22% of patients across the country will not return to the pharmacy to pick up that prescription.
Really?
Yeah, it turns into really large problems if you think about a patient that maybe has heart disease, or they got prescribed Xarelto, which is a blood thinning medication, and then suddenly you do not go and get that prescription picked back up, and then you are back into the hospital. So the simple premise for ScriptDrop is to build software that integrates within the pharmacy's workflow and their systems to allow for them to offer prescription delivery to me rather than asking me to come back to the pharmacy for a second or a third time. And it can kind of get into that number of patients that aren't coming back and give them a solution to get their prescription delivered to their front door.
So, by inference, what you just stated, there's 15 to 22% of patients are non-compliant with the doctor's orders.
That's actually just the side that don't, go and pick up their prescription. It's there's studies that even patients that pick up their prescription, up to 50% of them are non-compliant or non-adherent, and they do not take the prescription as the doctor told them to. They'll forget doses or cut pills, or only take it for 5 days or 7 days, where when it was a 30-day prescription. So it's a huge problem in the healthcare system across the country.
Yeah, you had a report on LinkedIn uh, that was published several months back, and it had a listing of all the conditions that people have that common medications are prescribed for, and it ranged from anxiety to diabetes. I was just amazed at the amount of people taking, like almost 10% of the country is taking anxiety meds. That's it's a huge number, and to think that of that percentage, maybe 50% from what you're saying is not compliant, they're really not even getting better. Whereas what you just described as your model with ScriptDrop will at least take one piece of inertia out of the way, where if they're getting their drugs, maybe they'll be more apt to take them. um,
Yeah. The term I often use is patient friction. The more friction that you have in the system, whether it's me going to the doctor's office or to make an appointment there, or getting a surgery or getting a prescription, each additional step that you ask of the patient, it creates additional friction. And each one of those steps, you lose out on additional patients that they get sick of it, or they just don't want to fill out the next form or to take the next phone call. The more friction that we can remove with technology, the better outcomes on the health side for patients as far as treatment.
I'm just curious, what happens to these medications that aren't picked up? Like, where do they go? Because once the pharmacist fills it, do they get recycled or?
No, so if the pharmacist counts out the pills and kind of gets it ready for you, and then you do not pick it up, legally they have 14 days to figure out either shipping it to you, delivering it to you, or you coming into the pharmacy to pick it up. and then they have to run what's called a reversal. So that sends the transaction back to your PBM, which kind of it manages the payments. And then the pharmacy can either send that drug back to the wholesaler, so Cardinal or McKesson or Amerisource, or they can just leave it stocked in their inventory and dispense that to the next patient that needs that type of medication that can come and pick it up or will actually sign for the delivery or pay the copay. So they're not wasted necessarily. You just miss out on that opportunity to help a patient that their prescriber felt like they needed that medication and they need that treatment. So you of course miss out on that opportunity to impact their life.
Now, I know that like handling of scheduled drugs, you have to be a doctor or a pharmacist to prescribe them. But what about the drivers that are delivering them? What happens? Do they have to have some kind of a certification, or is it the pharmacist that's actually the driver?
Yeah,
How does that work?
it's dependent on state. Some states have different rules and regulations on what type of certification you need on the driver's side to deliver some of the controlled substances. But what we found in the past is a delivery program that kind of creates a consistent package for every drug that is delivered. That removes some of that complexity. So the driver, he or she never has any idea what type of prescription they're delivering. It's just a very generic package or envelope that they're dropping off to the patient. That cuts down on kind of the fraud and abuse potential that oftentimes is brought up.
Going back to friction, in the healthcare space, it's so driven by third party payers.
Mhm.
Uh, how was your service paid for by insurance companies, or was it paid by the patient or the pharmacy? How
Um,
did
it,
that work?
it varies. So some PBMs have started offering to pay for the prescription delivery on behalf of the pharmacy and the patient, but it's kind of frequently and in the past fell on either the pharmacy or the patient to pay for that delivery. And what I've seen kind of transpire across the country is that you can have this slower delivery service that maybe is next day or takes 2 days, and the pharmacy makes that free for you and they won't charge you. And then they will allow the patient to upgrade and pay for an expedited service where it feels like you get that Uber type of experience. And then, of course, there's some pharmacies that they even ensure that that service is free. So it kind of that just varies across the country, depending on the geography, the pharmacy, whether it's an independent pharmacy or a chain pharmacy. So a lot of variability there.
Yeah, 'cause I figured that payment process would cause a lot of friction, right?
Yeah, well, of course, if think if you're a patient that you can't really afford to pay a $10 copay, and that is a reality for some patients, you couldn't afford to also incur the cost of a $7 or $8 delivery on top of that copay. It becomes financially not possible for patients in some areas of the country, which is really, really sad.
Now, what is the model at giftHealth? What are you doing there?
Yeah, so we have a huge vision for Gift Health. So I'll explain it in kind of pieces. We have acquired an operational pharmacy, and we'll kind of use that. I am saying the word of like a software test kitchen, where we can test it with our pharmacy, some of the software that we're building before we push it out to a network of pharmacies in the thousands across the country, which is really good for software to have that live interaction, that test user that you just can get feedback from all the time.
Absolutely.
It'll allow us to improve quicker as well. So the core, as we scale this, it'll be a smart RX routing platform. So any physician in the country, any patient in the country can work with our platform and send prescriptions to Gift Health, and then we will route that prescription to the best pharmacy for you, whether that is price based, proximity to your home, inventory, various things like that, so that you as a patient, if you are currently working with three pharmacies, which does happen a lot with polypharmacy patients and patients that are taking multiple medications for different disease states, you can kind of use us as your central platform, no matter what pharmacy you work with in the country.
Now, I know, like here in Pittsburgh, UPMC, if you go to them, those guys are adamant that you give us a name of a specific pharmacy and we will electronically send a prescription there and there only,
Yep.
which is, I find it terribly annoying because if you want to shop around for the price of that drug, it really eliminates that possibility from taking place.
So our vision is to solve that for you, where when UPMC says what pharmacy should we send it to, you just say Gift Health, and then we do that shopping for you.
Oh,
And then you, the patient, when you originally sign up for our service, you kind of outline what you most care about, whether that's quick getting the prescription the quickest, or if it's delivery or price, or kind of a mix of all of those, and then we can handle all of that shopping and routing and everything for you. And then if let's say you go to another prescriber outside of UPMC, you just tell that physician the same thing and say, just send it to Gift Health. I know that they'll figure it out and find the best pharmacy for me.
see, now that is a very cool idea.
We're excited about it.
Yeah.
We're very excited about it. There's other companies that have attempted something like this, and some that are operational and doing it. What we're using to kind of stand out is our background in integrations with pharmacy technology and EHRs and EMRs, and that kind of nationwide network of pharmacies to really kind of drive that fantastic patient experience based on the variables that you care most about.
Well, let's talk about that patient experience a little bit. You know, in our industry, in the cybersecurity world, especially with managed services, SLAs are ubiquitous. We are committing in writing to our clients that we will do X in X amount of time. And if we don't do that X, then you will get an amount of money back because we failed to meet our performance level. I have not seen anything like that in medicine, where there is for the patient, whether it be at the hospital, at the physician's office, or at the pharmacy, any kind of a service level that is promised. What's Is it simply because the market doesn't demand it, it's not needed, or no one has really made an attempt at making that a differentiating factor? What's the
Yeah, I
story?
think from my perspective, there's service levels baked into reimbursements to hospitals and to pharmacies. And then there are service levels baked into some enterprise contracts that Gift Health would sign with a pharmacy chain or a hospital system. But oftentimes the patient does not see those service levels, and or they do not understand how that impacts them. So you could take star ratings on the hospital side, that if the hospital has significantly more readmissions than they should, that can affect their star rating, and then again it affects their reimbursements that they're receiving for their services. But you, the patient, that doesn't necessarily guarantee that you get great service when you go speak to your physician, or that he or
Right,
she, that they're nice to you or anything like
right,
that. And it's because of the model in healthcare that oftentimes you're the patient, but you're not necessarily their customer, if that makes sense. So they're not, if you have insurance and a PBM and everything, that physician isn't getting paid by you necessarily. And I think that affects the kind of communication with some tech platforms and or physicians in the country. But of course, it's with anything. You have some that don't give great service. But you have numerous physicians and pharmacists and healthcare workers that they're crushing it. That their service levels and customer service, they care about that more than anything, and it certainly shines through when you interact with them. I recently had to go to my primary care physician, and then she referred me to a specialist. I had to have a quick procedure from an injury that I had. The primary care physician, she was incredibly nice and helpful and everything else. And then when I met the surgeon, he was very short, didn't really want to talk to me, and just wanted to get rolling on everything. I think it's just kind of human nature that different people interact differently, and sometimes when you're in healthcare and you're sick, you're frustrated anyways. So then when
yeah,
you go into the physician's office or the hospital, sometimes you're having such a bad day that no matter what they say to you, they can't make you feel better. about that day specifically.
I can understand it from that side, but ultimately, the patient is still the customer, man. I
Yeah.
somehow think they need to treat them like that. So, how is Gift Health coming? How is that project progressing? Are you guys seeing a lot of traction, or are you at a stage where you're launching to a broader market?
Yeah, so it's going really well. So we just started working on this a couple of months ago, and we've raised capital from investors, both Mucker Capital out of LA, and then Alos Ventures out of Indianapolis. And then we have already closed on the pharmacy acquisition. We actually closed on that this week. So we had been working
Congratulations.
on that for about 7 or 8 weeks, just going through diligence and everything that comes with acquiring another company. So I got to meet the team that's at the pharmacy this week, which was really exciting. And then we'll help grow that business. And then we're actively building out that software now. And we'll launch the public version for patients and physicians and pharmacies in February. So that'll be here pretty quickly. So in the next 7 or 8 weeks, and we're already contracting with partners ahead of time that they kind of understand the platform, and we've been able to give them demos on it.
So, you mentioned you have managed to raise capital, and when we think about that, in my past experience, it was either Boston or San Francisco, right? You had to be one of those two places. You're in Columbus, man. I mean, how this is not regarded as Silicon Valley. How, and I'm glad you're breaking the mold, but how did you break the mold? How did you get it?
Yeah, I would say that I'm further along on breaking that mold, or that the mold has been broken a little bit by folks that are building companies in Columbus prior to me. I know Cover My Meds, as they scaled and had the large exit in Columbus, that helped out so many people that and entrepreneurs that are starting companies in untold ways. And then recently, Insurance had an IPO, and they were founded and built in Columbus. So that kind of just reverberates to other entrepreneurs and helps them out as Root has their IPO. And then recently, I think it just got announced yesterday, Olive, they raised another 200 or 300 million dollars with over $1 billion valuation. So companies like that, they make it easier for smaller startup companies like Gift Health to raise capital. But the other thing that I've found is capital has been more accessible and easier to raise as a second time founder. There were times in the early days of me raising capital at ScriptDrop that it was rough. That I think our original seed round we raised $600,000 or $700,000 at ScriptDrop, and I had gotten turned down by 70 plus investors, and it took me 9 plus months to raise the capital, even with us having customers signed. So it was definitely like swimming through mud, raising capital at ScriptDrop in the early days. But I'm excited that it will be a little bit easier with Gift Health. Or just hard in a different way, if that makes sense. But it makes sense, and it excites me that we have a larger vision and we're tackling a larger market, so we can use that capital in a really meaningful and impactful way.
Now, I don't know if you're aware, but Dark Rhino Security, about 20% of our clients are healthcare related. That was not by design, it just has come to pass that way. And
Yeah.
we're grateful for that. But one comment that we would make is that I think we have our clients are forward thinkers.
Mhm.
I and my basis in saying that is that when we look at the total spend on technology in healthcare, and then we look at that relative spend in cyber, it's minuscule. And then when we look at the number of breaches and events that have happened, like just in Columbus, I think there was a urologist group that got shut down because their patients' records ended up in Eastern Europe
Yeah.
somewhere, right? And there's been a host of hospitals and health systems across the country that have lost volumes of very sensitive information, if you will, on
Mhm.
patients. What are your thoughts on it? What is cyber just not at the forefront of healthcare companies? Do they not think about it, or they would just take on the risk and say it's all right? What?
I think it probably depends on the segment. If you think about, you mentioned the urology clinic, they probably use an EHR, EMR. They likely pay quite a bit a month for that software. And
Yeah,
my,
and they were using McAfee or something or some. And I shouldn't say that. I don't know if they were using McAfee. So, but they were using some. They think their endpoint antivirus, that's their cyber, and
that
that's
covers them for everything. Yes,
yeah,
that's what I was getting to. That if they sent their EHR or EMR vendor a list of questions and said, "Are we covered for all of this?" My guess is that EHR vendor will get back and say, "Absolutely, we have you covered. That's why you pay for our software," and they want to reaffirm that to them. But as companies in healthcare need to get more technology forward. I think you having a cyber strategy outside of your core vendors is important. It adds additional layers of security because if you think about it, even if you have just good cyber through their EHR, EMR vendor, it's still resource allocation and constraints as you hire additional people that you can get socially engineered and socially hacked and different things like that. So I think it's very important for companies as you grow to have a true cybersecurity resource, even if they set up training for your employees as they come through and kind of
right.
reinforce that through your podcast or newsletter, because it as healthcare grows, the technology that is used will just get more complex and it will be more ingrained in every single step in the workflow as AI kind of becomes more prevalent across the entire ecosystem as well.
That's right. And I think it's a very vulnerable segment because when you look at the breaches that are happening, it's all about the money to the for the largest part, right?
Yeah.
Uh, it's pay us a ransom or we'll release the data. Even
Mhm.
if even if they have their system set up so that they can recover from being locked out, they'll say, all right, still pay the ransom or we're dumping the data on the market, right?
Yep. And
It's
normally
about
they want the payment in Bitcoin or ETH.
they want the payment in Bitcoin, man, and um, it's about the money. And healthcare companies have a lot of money. I mean, there's a lot of money out there to be taken, and I think there are very easy targets because you look at. I look at the management of a lot of these health institutions. They're physicians who are extremely well trained individuals in their respective profession.
Yeah.
When it comes to cyber, it's kind of in the world of IT, we would be the neurosurgeons. It's a
Yeah.
very specialized area. It's a highly specialized area, and a generalist is not going to address it properly. And I just don't think that they have the awareness, if you will, that that is in fact the case, and that they should be looking at some degree of spend there.
Yeah, well, I almost compare it to focus and focus where you're focusing your time. If you're an hospital administrator, you're focusing your time on hundreds of different things. Versus if you think someone that is trying to hack your system, they're making that their job. So them hacking your system, they're going to be better than you are at defending your system if you're doing 200 other things, which most administrators are. So getting someone else on your team through a vendor or relationship or software that their job is to protect your system and that's their only job, you have a much better and much more defensible strategy of combating these hackers.
I am going to steal those words from you, Nick, because I couldn't have said it any better, man.
Put it
That's
in the subject.
we'll send you the commission check. No, that you very eloquently summed that up. Because just today there was a report released by IBM, and it was about how there has been a concerted effort of attacking the vaccine delivery chain. So they're
Mhm.
not attacking the manufacturers per se, they're attacking the delivery chain and want to compromise that in some way. Now, in this instance, they think it's a nation state, so the motivations are not about money necessarily. They're more nefarious.
Yeah, to incite chaos.
Yeah, inside chaos, as the case may be. But when I think about your models that you've developed on the delivery side, do you see a vulnerability there that needs set of vulnerabilities that need to be closed or
Um,
be
So on the tech side, I wouldn't want to speak to that in with exact specificity. But I think when the vaccine is rolled out, I think there's going to be thousands of vulnerabilities. Just if you think of the supply chain, and we're effectively distributing a vaccine to, and this has never been done in human history. It'll be the most demanded vaccine in human history. Um, I envision long lines and resource constraints and everything, because we have been locked down as a country or as a world for many, many months now. And then the vaccine is effectively that promise or that light at the end of the tunnel to allow us to resume to normal lives. So I think just the idea behind that of that type of demand, I think it's going to stress the system significantly. But if collectively everyone knows that, and you know that we need to all work together to help with distribution or help with communication about the vaccine, anything, kind of view it as an all hands on deck effort. Uh, we'll kind of work through those kinks and work through the wrinkles and just make that solution and the end-to-end distribution, all of that, better by the day. But I think it'll be really tough.
are there specific areas that you have seen through experience that might be more vulnerable to cyber than others, or functions that you would say, hey guys, if you're not going to do anything, at least do X? Do you have any thought or guidance on what that X might be? I'm kind of putting you on the spot here, Nick, but
Yeah. I may not have too many great examples or great feedback. But one thing that I've seen that it helps on kind of avoiding your system get hacked is on the enterprise side, especially because that's frequently what I've been in healthcare, is having a different sign up and login process for the system for your users that's outside of your core website that anyone can go to, where you don't have such easy access for account creation and all of that. And then that's when someone can create an account and then kind of get in and poke around and expose vulnerabilities in a much easier way. So we've always segmented up and had a different sign up process for accounts and a different login for accounts that frequently was not published to everyone. You couldn't find it in a Google search, anything like that. And of course, if you don't have as many people trying to beat down the front door, it ends up being quite a bit safer. But it's something that you just constantly have to be monitoring. And we got to at ScriptDrop where we had an entire team that's all they thought about was security and just making sure that our system was impenetrable, or as close to impenetrable as possible. But the fact is, there's companies that they do not have the resources for that, and or the knowledge. So it's at that point finding the right partner to handle that for you, so you can have that peace of mind.
again, turning back the attention to you a little bit, Nick, I'm sure. So, Gift Health is going to be immensely successful. Have you thought about what's next? Where do you see the future going 15 years out? Do you have a vision or insight as to how you see things evolving in your niche?
Certainly, technology taking even more of a front seat, or even the driver's seat in healthcare. I'm really excited about not what outside of what Gift Health is doing, but I'm really excited about some of these companies that are being founded that are applying AI to drug discovery. I think some of these companies, there was one that was just funded today really heavily by Andreessen. I think that those companies are going to discover really life changing and foundational and breakthrough drugs really quickly by applying AI to drug discovery. That's something that really excites me every time I read about it. It's not my skill set, so I can never contribute towards that field, but it's just incredibly interesting to envision AI eventually being able to solve cancer, and you don't have so many people that die of cancer every year. That's something that I think would just be monumental for human history.
Now, your AI is applied a lot to big data problems. Do you see, you just mentioned drug discovery, but given all the data that we have on medication use, interactions, outcomes, is there an opportunity for an AI company to leverage that existing data to better outcomes with what we have today? That's
Um, there would be in theory, but the issue that frequently these companies run into is data access. So in healthcare, there's so many of these silos set up where you cannot get access to the data to put together a full data set, so you can apply AI or machine learning to that and really drive innovation. I know that HHS, several months back, they published a notification that they're going to change data standards to kind of allow data to be opened up more in healthcare. So think of it, rather than a data silo, you have a data lake that everyone can go to, and as long as they have the right tools, that everyone can access this large data set. I think once that is set up in that manner, is where you'll see innovation get expedited in healthcare, so that so many of these healthcare companies do not view data as, this resource that they can't allow anyone else to touch or access, uh, versus viewing it as this collaborative effort, to positively impact patient care.
Nick, do you see a place again for big data to lower the cost of healthcare? Is there an opportunity there?
Yes, I think so. Of course, you have to kind of sometimes fight through red tape or just entrenched players that have been here forever, that they've set up so many barriers and dug out a huge moat that it's hard to compete against them. But that's something that we're wanting to do at Gift Health, as our second phase, that we think it will impact the cost of prescriptions and lower the cost of medications for patients across the country. We'll be building out a PBM as a service. It's my expectation that we'll have this live by end of summer next year, and that'll set it up to where, think of Twilio, if you've ever used Twilio to build SMS apps. At
Okay,
this point, when you used Twilio 4 years ago, you had to write code and you had to run
right.
servers, and it was more technical to get a SMS app launched. Now it's a workflow tool, if you want to, that you can drag and drop and just type, and then you can launch an app with zero coding. So we're taking that same mentality and applying it to the PBM space, so that you, as an entrepreneur, if you want to launch your own PBM, you do not necessarily need to understand that. You can launch it on Gift Health's platform, and our tech will power that PBM for you. If you're an enterprise company, such as a chain like Kroger, or Walmart, or any of those, you also could launch a PBM on top of our platform, and not necessarily need to understand, the plumbing and how it works, or the tech. You just go out and sell that solution and impact patient care in a really positive way. I think doing that will drive more competition in the PBM space, which will lead to better drug prices for all of us, which is a really exciting mission that we have.
Is that where the name Gift Health comes from? Is that the gift in Gift Health, or
So not exactly. Kind of the name comes from. I know that all of us value health, but you don't value good health until you run into issues or you get an illness or anything. So the name of the company, it's just a constant reminder that good health is a gift, and it's something that we want to keep at top of mind. That the patients that we interact with and the users that we contract with and partners, we all want to give that gift to patients consistently, of them having better health.
that's a very noble thought and mission. And it's great to see someone like you in the space actually saying that with some heart, because I think that's what's going to take to make a material difference. And
Yeah, I agree. Healthcare, there's so many opportunities to drive positive impact. It's sometimes difficult, but it's definitely challenging, which excites me because it's fun and it's just hard problems. You can really get interested in and kind of get behind, if that makes sense.
it does. I know, Nick, we're here at almost at the hour. You've been very generous with your time. Is there some company or yourself or any meetings or events you're doing that you'd like to plug and let our listeners know about?
Um, uh, Not right now, which is it's a little tougher. I haven't been as active in some of the events with COVID and everything. I did recently join the Columbus Leadership Council. I was asked to join that, and that's something that I'm excited about. Where it gives me the opportunity to get out into the community and mentor, and then of course learn from other folks. Where I have that opportunity to constantly learn and grow, which is always important to continue that journey of self growth.
Fantastic. And on that note, Nick, we really appreciate your time. Thank you for joining us today.
Absolutely. Thanks so much for having me. I really appreciate it.